Welcome to another connection here on TKO8 Television. Dennis King, thanks for joining us this week on our show. Every Monday we come in and do a show here in Studio B with different organizations, different people coming in to talk about things that should be important to you around our viewing area. And we certainly appreciate you joining us. As a matter of fact, if you're part of an organization or if you're an individual out there that would like to get some information out to the public, give us a call here at the studios and we'll be happy to put you on the show. We'll schedule you out. We do one every week. Stay with us. Be back in a moment. We're going to talk with two individuals from North Arkansas Regional Medical Center about something that's important to all of us.
We moved here in June, 18 years ago, and had not been in the house more than a week, and I popped my hip out of joint. And that was my first experience. And of course, the ER saved my life. I had an aortic aneurysm, and it had leaked all night. As soon as they brought me in here, they knew exactly what it was and exactly what to do.
Hello, this is Michelle from Nature's Wonders. It's the most wonderful time of the year. Time for all-natural ham, gluten-free stuffing, non-dairy eggnog, non-GMO mashed potatoes, and paleo pumpkin pie. Oh wait, maybe that's not on everyone's list. But if it is, we have everything you need to make a healthy and diet-specific feast for friends and family. Let us help with your shopping list so that you can enjoy the holidays. Located on Highway 65 in Harrison, just down from Thompson's Ace Hardware. Thank you to all of our customers who are the reason we do what we do, and thank you, Jesus, for being the reason for the season. Merry Christmas and Happy New Year.
Back on Connection here on TKO8 Television, and our first guest in the studios today from North Arkansas Regional Medical Center, Vince Least and Debbie Johnson. Thank you both for coming in today.
Well, thank you for having us.
We appreciate it very much. Something on the minds of everybody these days, not just in the medical field, but it personally, is insurance. So let's talk a little bit. Debbie, I'll let you kick off, if you would, about the sign-up you got coming, and then we want Vince to get a little more in detail on this.
Sure. There are still a lot of people out there that don't have health insurance, and we want to try to help them with that. So on January the 12th, from 12 noon until 6 o'clock in the evening, we're going to have a sign-up event at the hospital, the first floor tower waiting room, and we're going to have local health insurance agents there on hand to help people sign up. They can get signed up that first day, right there. And also, if they just have questions, if they just want to come in and ask questions about health insurance and how to get signed up, we'd love to have them.
That's great. Vince, the hospital itself, I know this whole private option thing, Arkansas going the route that it has, and of course there's a lot of discussion in the legislature. I guess is going to be looking at it again. I know the governor's got different ideas about it. Why is NARMC getting involved in this?
Well, let me give you just a little bit of a background on this. If we go back as far back as 2010, when the Affordable Care Act was passed,
okay,
and contained in that were a number of things that were driven to provide health insurance to folks who, prior to the passage of that act, couldn't get it. One of the things and the key things that happened was a reduction in the payments to doctors and hospitals for Medicare. Now that reduction was designed to create a pool of dollars that would then be distributed to states to expand Medicaid. Now in Arkansas, Medicaid took care of folks at 17% of the federal poverty level and below.
Okay.
Under this new plan, called the private option, soon to be called Arkansas Works after the first of the year in 2017, the plan covers folks at 100% level for a poverty level of 138% and below. So it's a lot larger population of folks. Now the money that the federal government extracted from hospitals and doctors is given back to states that expanded Medicaid. Now initially the act required states to expand Medicaid. Supreme Court ruled that the federal government cannot tell states how to do that. So now Arkansas, even though it's a very red state these days, saw fit to expand Medicaid under a program called the private option. And that lets folks take this money from the federal government and buy health insurance off the Federal Insurance Exchange. Now, 138% of the federal poverty level is folks who make $16,000 and below for one person, or about $32,000 and below for a family of 4. Now, what does that really do? That provides an opportunity for people to access health insurance based on their income. It also provides an opportunity for people to get a subsidy to pay for their health insurance up to 400% of the federal poverty level, which is about $90,000 for a family of 4. The more people make, the less the subsidy, but they can still buy health insurance off the Federal Insurance Exchange. Well, there's 2 reasons. First of all, we're a community hospital.
Right.
We want folks in our community to be as healthy as they possibly can. And second, we really want to find a way that we can offset the cost of providing care to a lot of folks. Now, prior to the private option, our self-pay number, and the self-pay is a fancy word for we're not going to be paid. That means that was about 9 and almost 9.5% of the folks who came to our front door at one time. With the private option in place and people in our community accessing it appropriately, that's down to about 3.2%. So let's go back to the original discussion. I said that there were payments reduced to hospitals for Medicare and payments reduced to doctors. Now, the offset of those dollars flowing back in to take care of that population that we were taking care of essentially for free is not equal. We're still upside down a fair amount of money. But at least in Arkansas, there is a method to recoup some of that. Now, how does this all work? We were providing primary care essentially through our emergency facility prior to the private option. Now, a person who has a card from the private option who qualifies can go see their primary care doctor with that card, and that visit will be paid for. So it improves the health of a population of people who were not getting access to insurance. It eliminates them going to the emergency room to get their primary care. And it really kind of improves the overall well-being of the operation of the facility. And the doctors are able to see these patients in their offices and deliver care at the right place, at the right level. So overall, Arkansas has benefited from the private option. Now, what you're seeing, and you mentioned in your intro, is that the legislature is surfacing a report that they have worked on this last year to the governor. The governor has already said he's going to call a special session, and now he says it's going to be in April. The purpose of that special session is for a plan to be developed to replace the private option. Now, there may be co-pays and deductibles on this new plan. There may be restrictions on assets people have. There may be lockout periods for people who don't pay their premium. There may be a lot of things in it, but I think the real fact remains is that Arkansas most likely is going to retain a plan so that folks can access insurance that previous to this didn't have access.
You know, and the thing about it is, Vince, is that people out there, it's so complicated.
Yes, it is.
That people don't understand it. I talk to people on the street, and I see people all the time, and people that I know that that are in the lower income brackets, mm-hmm. or you know, maybe work at a factory or Walmart or whatever, and I say, well, how's the new insurance going? Well, you know, I'd like to sign up, but you know, you get on that website, and you know, I just don't understand the computers, or I don't have a computer. I had to go to the library and couldn't get anybody. It's a real issue for people, particularly maybe a little less educated population out there that needs it the worst. And a lot of them fall into the category you were talking about with a community hospital. They weren't paying anyway. It's tough. And so these kind of sign-up situations, if you can get the people there, let the professionals explain it to them in layman's terms where they understand black and white it can make a big difference.
Well, I think it's important for folks who are listening to you to know that these sign-ups are low. There's no pressure, not just low pressure, no pressure. We're there to assist them in signing up. They just need to bring out a little bit of personal information, and then we'll try to figure out what's best for them. And then, as Debbie mentioned a minute ago, some of our local insurance agents have gotten involved to help us.
To help you do that.
And I think overall it benefits the community and benefits the state. And in states around us that did not expand Medicaid, such as Missouri, Kansas, Oklahoma, those hospitals are seeing reductions in Medicare with no way to get any revenue back from caring for other folks. And it's creating a real tough situation. Hospitals are closing across our country.
Yeah, I know they are. The penalty side of this for people, they may not understand. Just briefly, how's that affecting people?
Well, this year, the penalty can be somewhere between $600 and some dollars up to $900. So if a person does not have health insurance and files a tax return and is expecting a refund, and they have no way to prove they have health insurance, they could take up to a $900 hit on that return as a penalty for not having health insurance.
Yeah.
And $900 goes a long way to providing premium.
And that's, say, $900 per adult, and half that for each child in the family. So if you're a family, that can really add up.
Well, the thing about it is, we haven't gone through that yet.
No.
I mean, this is the first full year of this program, so the people are not going to realize it until they do their taxes
Absolutely.
in 2016 for 2015, and some of them are going to have a big surprise coming, and because a lot of people didn't take it very serious.
Yes.
Well, it's not talked about a lot, and it's not really in the media a lot.
No, it's not.
But I think there's going to be some folks who are going to get some surprises this year, and it's going to be a tough one.
Yeah, it is. So this sign up again is, tell us.
It's January the 12th. That's on a Tuesday
Okay.
from 12 noon until 6 o'clock in the evening.
On the first floor?
And the first floor of the hospital waiting
Okay.
room. And we just want to get the word out for people that really don't know, like you say, maybe you're not computer savvy,
Yes.
that just need somebody to help them.
Yeah.
So we'd love for them to come by on that day.
Yeah.
And in fact, this will be the last time we will offer the sign-up events. We've done one every month during the entire
Period.
enrollment period, but this will be the last one. So we want everyone to take advantage of it.
Well, and they need to realize the time is closing down on them here.
Yes.
So anything else, Vince? We got
Well,
a couple minutes left here.
Just to follow up with what Debbie said, just because we're not having an event doesn't mean we wouldn't sit down and help somebody sign
Okay.
up.
Sure.
So they could call Debbie at the hospital or call me, and I'll hook them up with the right people. But we want people to get access to this. If they're eligible for it, they should have access to it. And I think it's really, it's very nice for you to allow us to be here and talk about this, just to get the word out.
Yeah.
And I think there'll be a few more things in the paper as we go along, but I think it's extremely important for our community.
Yeah, I'd love for them to call me at 414-4142, and I'll do what I can to help them.
Well, that's great that you're having this event, and I've talked to a couple of independent agents here in town that are offering services, and so some people say, yeah, sure, this insurance person wants to get me in his office so they can sell me something I don't need. But there's a lot of them that sincerely, they deal with several different companies,
Yes.
and you can tell them kind of where you're, what kind of deductibles, what you can afford, and they can kind of steer you in the right direction.
Exactly.
And
Sure.
so that's good. But that's great that NARMC is trying to help people to get in this program. And I think Arkansas, and who knows how it's going to all shake out once the legislature takes the findings of this committee and goes through it, but hopefully it'll still be some type of a private option program.
Well, it should add value.
I think it will. Vince, thank you so
Yes,
much,
sir.
Debbie,
Thank
for
you.
coming in
Thank
today.
you.
We'll get this on broadcast on the social media so we can try to touch some people that maybe don't know about what's going on. And it's great that the hospital is trying to do that too. Thank you so much.
Thank you.
Stay with us. Be back in a moment. We're going to talk with some people about a big event coming up. It's the second year for Rotary to be giving a car away to a needy family.
Crystal clear mountain streams, river rapids, and rolling hills with endless valleys. The beauty of the Ozarks we often take for granted. At Magnus Toyota, we never underestimate the value of our customers. As a third-generation family-owned business, Magnus Toyota has been operating here in the Ozarks for over 50 years. When we make a new deal, we make a new friend. Stop in and visit us today and see why our customers say we're the best. Magnus Toyota, your hometown Toyota dealer on Highway 65 North in Harrison.
When you support a locally owned pharmacy, you're contributing to the growth of the community. The dollars you spend stay right here to support our local community. Health Mart pharmacies are locally owned pharmacies. There's one right here. Health Mart pharmacists have a personal commitment to their communities because, just like you, they support their community. Health Mart pharmacies are locally owned and hometown proud. Harrison is a Health Mart town. Sam Alexander Pharmacy on the square downtown. Health Mart, caring for you and about you.
Welcome to another connection here on TKO8 Television. Dennis King, thanks for joining us on the show today. Our second half of the show has to do with a great organization here in the area, not new to anyone if you've been here very long, Rotary, which is an international organization. We have two young ladies in the studio today to talk about an event that actually started last year, and it's a great program. We want them to tell us a little bit about it. We appreciate Chandra Tapley and Tabitha Campbell. Thank you for coming in today. They kind of stuck you in here, didn't they?
Yeah.
Poor old Kevin just didn't want to come and see us this year. Okay, let's talk about Rotary just for a minute, if you would, Tabitha. Just let people know kind of what you do. A lot of different things.
A lot of different things. As you said, Rotary is an international organization, 1.2 million members internationally. Our local organization is the largest civic club in Harrison, started in 1919. So like you mentioned,
Wow.
Been around for a while. Really, Rotary members start with a commitment to service above self. That's really what it's all about. And we're involved in a lot of different aspects that entail that service above self.
The Rotary organization, like a lot of organizations out there that in the community, are very community oriented, and Rotary, obviously you have a good cross of people. You have women and men, various age groups there, because you touch a lot of different people. Well, some of the things that, just if you might touch on the different services that you provide.
We provide a lot of scholarships to our local schools and the single parents for higher education scholarship. And, we help a lot of local self-help agencies like Sharon Care, Sanctuary, CASA, Housing, Boone County Special Services, the RAP Crisis Center, many of the local service organizations.
Do you meet once a week? Do you all meet?
Well, yeah, once a week on Thursdays at noon. And like Shonda was saying, all of those local organizations that we help through a program we call every year Love Fest. And we raise funds throughout the year, and then they apply, and we're able to distribute, last year I think it was $15,000 to those local organizations here in our community. And that's in addition to what Rotary accomplishes internationally, like eradication of polio.
Yes.
I think it's scheduled to be eradicated by next year. There are like 2 third world countries that it still is in, and that's it. And that has been largely due to Rotary's international efforts. And so, we, like you said, we touch a lot of folks, locally and internationally.
Yes.
And locally, we have a free dental clinic that we operate weekly.
I was going to ask
and
you
that
about
helps
that.
a lot of people every week. So it's, we have a lot of volunteers that go and do everything in the clinic, to help people with their dental health.
Where is the clinic now? Where do you? Is it still out the same place?
Near the fairgrounds,
yeah,
back
that
in
Forestry
behind
building
there.
used to be there.
Yes,
Yeah.
and a lot of our local dentists come, as Shonda said, once a month, and then we Rotarians that aren't trained, in the
Sure.
dental field go and help with just scheduling and paperwork and all of that kind of stuff, and it's. Those people are so thankful for the help, every month.
That's fantastic. During the year, I'm sure Rotary, if I remember, I can't remember them all because so many different organizations, but your fundraising efforts throughout the year, let's touch on that a little bit. Don't you have some kind of major events during the year that pretty well raise to raise the funds?
Yes, and in years before, Rotary was raising funds all the time. There was a fundraiser going on all the time. In the last couple of years, through our Rotary in Motion car giveaway program, they've really sort of narrowed the focus to raise funds one big time and then be able to give away this car to a family in need. And so that's really what we're focusing on right now. And so we've asked, local businesses and organizations to donate and sponsor to help with that program. And then we have our Spaghetti Supper, which is our big major fundraiser. And that's going to be on January 22nd this year in conjunction with the car giveaway.
Very good.
And that's really our big one.
Very good. Just roughly, about how many members do you normally have in Rotary? I mean, is it about average like most organizations? I guess?
Our last member that we installed was week before last, and I think he was number 89.
Okay.
Now, of course, all 89 are not at every meeting every
Sure.
week because we all are, have jobs and all of that.
Sure.
I think, how many would you say we have every week? Probably
50, 60. Yeah, I was gonna say.
65.
Yeah,
It's a
that's good.
Nice full room there. Western System.
Nice organization. Let's get into this event that you've got. I think it's the second year. I think you started last year. Rotary in Motion car giveaway. Kind of the background. Just either one of you. Just kind of tell us what's going on there.
Well, last year we gave away a Ford Focus to a family in need, and it was a huge hit. It was someone local, and local we send out applications to nonprofit organizations, and they can nominate up to 3 people or 3 families to receive the car, and there's a selection process from there. And this year we're giving away a Dodge Avenger on January 22nd, and we're very excited about that. That car is really nice. I saw it the other day, and it's really nice.
Wow. So I'm assuming that does Rotary have to purchase the car, or somebody donate the car?
Depends. Sometimes someone will donate it. This year the car is sort of both, I guess, because we did purchase it, but the person that we purchased it from allowed us to buy it for less than market value. It was a car that they had, and so it's a community effort, just like everything else, that Rotary does. And like Shonda said, it's a really nice car, and we're really excited for a family who is in need of transportation to have this car. Kevin Merrill and his team at Main Street Service Center are working it over good and making sure that it'll be reliable. We were visiting with him about it this morning, and he said it's got at least another 100,000 miles, on it, that it'll go. So it's going to be a great,
they're getting it ready to go where it's not going to have a problem.
And it looks nice too. It's going to be a car they can be proud of.
And it's, it does need some minor repairs.
Right.
And we're hoping to get some help with that, some local donations to help with the cost of the repairs.
Okay.
Because Kevin's shop is doing it, but they still have to pay for some parts and things to help them through this. But it is really a nice car. And through that, we'd like to make sure we remind everyone that we're having our spaghetti dinner on January 22nd.
Okay.
And the tickets are $6 each.
That's during the Goblin game, is that correct?
Yes, the Colors Day game. And we'll present the car winner then.
Okay.
And so we're really excited.
Let's back up just a little, if you would, on the qualifications, or how do you get how do these people
to be
get their
awarded
names?
the car? We send a letter every year to these local organizations that we help through Love Fest, who we know are in contact and in the business of helping people who might be in need of transportation. So we ask them to nominate up to 3 each, as Shonda said, and then we take all of those applications, and we have a committee that goes through those and selects the family that we feel would benefit from it most. And of course it's based on need, and the application details why they have a need and what they do. Last year's winner, Nancy Dees, was selected because not only was she putting herself through college, she was putting her daughter through college. She works in the local school district, and so she's really involved with our local kids. So she was giving back and working hard for her family, and we just couldn't have picked a better recipient last year. And so that's sort of the selection process.
That's kind of the way it goes. And there's a lot of people out there that they may be working, or people out in the audience, you may know people like that. This is a great program, but always think about that when you're out there doing different things. Many times it's the little things that will help these families out. We're obviously in the holiday season here, which is tough on a lot of families out there. But transportation is so important. I mean, first of all, if you don't have transportation, it's hard to get a job and keep a job. If you have children, to get them to school or wherever to go purchase groceries, it's just difficult. Even though we do have a transportation system for a small town that's pretty good, that people can get on the trolley or that makes it very difficult to schedule around and go places. And so the automobile thing is, I think, a good idea. Did the Rotary, is this something that Rotary International has done, or who came up with this idea last year? Do you know?
It's a local program, and I believe Kevin Merrill sort of was, and he mentioned to us this morning that he had noticed that the club was fundraising all of the time, and then it just felt like club members were tired, the community was tired, and so this was really an effort to sort of narrow that focus and do something great for a deserving member in our community, and just give somebody a hand up. So, that's really what we're looking for, is just a family or an individual who needs that and will take it and make the best use of it.
The donations that you get come in for this, do you wind up with more money than you'll need for the car? I mean, can you take any of this money and put back in the Rotary program?
Yes, and that's what they did last year, that we mentioned, through our Love Fest program. Okay. So they take, all the money that is raised and repair the car, buy the car, whatever needs to be done to, turn it around to the family who needs it. And then anything that is raised above and beyond that through the Spaghetti Supper and through, sponsorships of the Rotary in Motion program, then is distributed back to our local agencies through our Love Fest program. And like I said, last year that was $15,000.
Wow, okay. That's fantastic. Have we covered everything? Sponsorship. Well, let's talk about the sponsorships, the levels. I've got your deal now. I don't want to put you on the spot, but you've got everything from looks like a $50 to $100 sponsorship, which would be like an oil change sponsor. Tune-up level $100 to $249, tire level sponsor $250 to $499, and then transmission $500 to $1,000. So there's a lot of money going to be spent to make sure that this automobile is in good working condition. So if you're out there in the viewing audience and you'd like to get involved in this, how's the best way to get a hold of somebody as far as the Rotary goes?
They can. We have a Facebook page, of course. Kevin Merrill is our president-elect and very obviously involved in this program, and so he can be contacted at Main Street Service Center. You can call me at Community First Bank or Shonda at Harrison Housing.
So any one of you could guide them in the right
direction. And just
direction.
Ask around. Everybody probably knows a Rotary member, really.
I started to say, with that many, close to 100 members, you've probably got somebody in different businesses all over town. So.
Right, and there's lots of opportunities to help, as you mentioned, through the various sponsorship levels. And then the other thing folks can do is just come out into our Spaghetti Supper and enjoy that with the community. There's drive-through service. If they'll go by the K-Life barn that night, you can just pull up and order. You don't have to pre-purchase a ticket.
Oh, okay.
Or you can come in to the high school during the game, and you don't have to pre-purchase a ticket. Just walk up and do that, and that helps us as well.
That's great. Thanks for coming in, both of you, today and explaining this program. It's a wonderful program. I'm glad to see you doing it again this year. Some families are going to be very happy that have an automobile to drive and transportation. Don't forget, if you're out there, Rotary in Harrison, a great job of helping a lot of different people, and we talked about some of the many benefits that they bring to the community. The Spaghetti Supper is a big fundraiser coming up on January 22nd. It'll be during the Colors Day festivities at Harrison High School in the gymnasium. They'll be serving in the cafeteria area. You can go through K-Life and do a drive-through there and don't even have to get out of your car, and they would appreciate it. Thank you both, Chandra, and thank you, Tabitha, for coming in today. Good luck with your program, and thanks for all the hard work in Rotary.
Thank you.
Thanks for joining us this week on our show. We appreciate you coming and seeing us every Monday as we talk to different organizations and different people about different things that should be important to you. It's our area, it's our community. Help them out anytime you can. We'll see you again next time.
Shiny Shelby stickers are sure to be seen under any lighted Christmas tree adorned with red and green. This holiday season, let Shelby's help you add some shine to your Christmas. Our latest collection of old world ornaments are sure to please any collector. Fill your kitchen with the aroma of aspen mulling spices as you whip up one of our easy appetizers or snacks. Don't forget the kids. We have plenty of shiny, new boy or girl elf on the shelf just waiting to be adopted. Shop local at Shelby's this Christmas. We are sure to put the shine on your gift giving.
John was the first one to be an inpatient here, and everything was great. And I had heard some negative things about the hospital, and I'm going, what are you talking about? This hospital's great. Why would you want to travel over to Fayetteville when you have this great hospital? All the nurses, everybody, phenomenal.
Gifts, gifts, and more gifts. That's what you'll find at Sisters Flower and Gift Shop. Come in and browse our vast assortment of unique Christmas ornaments, wreaths, and wall decor.
For the holidays, Sisters has added a new line of candies, cookies, treats, and snacks, all for under $10. Whether you're looking for a bold centerpiece, an artistic floral arrangement, serving pieces, or all-occasion tabletop items, Sisters has something for everyone. Sisters Flower and Gift Shop. We are so much more than flowers.
KTKO Channel 8 Harrison. Local television worth watching.